Hello, my name is Teresa Lee and I am performing my abdominal exam video. This is for MSN 572 and today's date is May 22nd, 2024. I'm going to start off with a 360 room scan. Got 4 walls there, and then I don't have anything on my board here. There's nobody. And then here's the ceiling and the floors. Alright, so I'm just gonna prop it up. All right, so we're gonna go ahead and get started. Go ahead and dig your feet here. So this is my son, TN. We are doing the abdominal assessment, and he does have you do have my consent to do the abdominal assessment as well as posting it on YouTube as unlisted for grading. Do I have your consent to do so also?
Yes.
Perfect. All right, so go ahead and lay your head back here, and then you're gonna swing your legs up here. And I'm just gonna give you an extra pillow here for comfort. All right, and then I did wash my hands. And we're going to start off with inspection. So I'm actually just gonna lift your shirt up right below your nipple line here. Perfect. So starting off with inspection, I am noticing his abdomen is slightly round. I do not notice any lesions, nodules, any rashes or redness, inflammation on his abdomen. I do not notice any peristalsis. I'm looking at the sclera of his eyes and his skin tone, and they are both non-icteric. So negative for jaundice. First, I'm going to start with auscultation. So I'm going to start with the auscultation of the 4 quadrants for bowel sounds. And then you don't have to do anything. I'm just going to move my stethoscope around.
Okay.
I'm starting at the right lower quadrant, right upper quadrant, left upper quadrant, and right lower quadrant. Or I'm sorry, left lower quadrant. Perfect, and that is normal active in all 4 quadrants, normal active bowel tones. Next, I'm going to listen for the abdominal aorta, which is in this epigastric area here, slightly to the left. No bruits heard. Next, I'm going to move inferior slightly and bilaterally for the renal arteries. No bruits heard. The right side. No bruits heard. Next, I'm going to move on to the iliac arteries, which is superior iliac crest and at the midclavicular line. No bruits heard, and same for the other side. No bruits heard. Next, I'm going to listen to the femoral arteries, but for modesty in the video, I'm going to go over clothing, but in clinic, I would go onto skin. So I'm just going to find it here. No bruits heard, and other side. No bruits heard. All right, so the auscultation section is completed. Next, I'm going to move on to the percussion section of the assessment. So I'm just going to percuss the distal interphalangeal joint here of my middle finger on my left side. And I'm going to start in the quadrants. I'm going to start at the right lower quadrant, and I'm listening for tympany versus dole. That is tympany, 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 tympany. So I hear tympany in all 4 quadrants. Next, I'm going to percuss the bladder, and that is also tympany. which tells me his bladder is probably not very full. Next, I'm going to percuss for the liver. So I'm starting in the right upper quadrant and working my way up the mid-clavicular line until I hear dullness. All right, and I hear that here, so I'm just going to mark him out there. And then since I am percussing, I'm just going to go ahead and percuss for his liver span. So I'm actually going to start at a higher intercostal space here, still mid-clavicular line, and I'm going to percuss from resonance until I hear dullness. All right, and I hear that here. Okay, and I'm just going to measure. Perfect, and that is about 6 centimeters, and the normal liver span is 6 to 12 centimeters long. All right, so next I'm going to percuss for the spleen, and that is, I'm gonna look for the mid-clavicular line on the left side and then go slightly lateral to that. And again, I'm going to start at the left upper quadrant and percuss from tympani until I hear dullness. All right, and I do not hear any dullness there, so I was unable to percuss for the spleen, which is a normal finding. All right, next part of this, I'm going to do some light palpation. Let me know if you have any pain or tenderness. And start at the right lower quadrant. Work my way across. Any pain or tenderness? Good. And now we're going to do some deeper palpation. Again, I'm going to start at the right lower quadrant and make my way around.
What do you mean by tenderness?
If it hurts.
Oh.
We've got some areas that are, like, feel a little bit more sensitive. All right. So nothing there. I did not see any grimacing or wincing. Next, I'm going to palpate for the liver. So go ahead and take a deep breath in for me. And then I'm going to put my fingers kind of under his rib here, and then go ahead and exhale. Perfect. And I was able to palpate for that liver edge there. Next, I'm going to palpate for his spleen, again, mid-clavicular line, slightly lateral, and then go ahead and breathe inwards. All right, and I did not feel anything there, so it is normal not to be able to palpate for the spleen. That is a normal finding. All right, so next I'm going to perform the specialty test. There is Murphy's sign, which is the test for cholecystitis. So I am going to have you exhale all the way for me. And then I'm just going to put my fingers, go ahead and inhale. And then I'm going to put my fingers right under his rib cage here, kind of tucked away. And then go ahead and exhale. And now inhale. Any pain or tenderness when I have my hand placed there?
No.
Okay, so that is a negative Murphy sign. If he had any tenderness, or if he was unable to inspire as my hand was placed right under his rib cage there, then that is a positive sign for cholecystitis. All right, so the next specialty test is the fluid wave test. This is testing for ascites. If I had an extra person here, I would just have them firmly place their hand right in the midline of his abdomen, and then with my hands, I would place them on both sides of his obliques here, and then with my right hands, I would tap the abdomen and feel for any waves that I can feel on my left hand. So any waves that kind of shift across or through his abdomen, which we don't feel anything or if I don't feel anything, it would be negative for ascites, or at least it would be a mild case of ascites. All right, and then the last specialty test is something for appendicitis, which is McBurney's point. So I'm going to go to the superior iliac crest and then come midway to the umbilicus here. So we're here at McBurney's point. I'm going to go ahead and palpate this area. Let me know if you have any pain or tenderness. Any pain or tenderness there?
Just a little bit.
Just a little bit. Is it pain?
Kinda.
Okay.
It's like this.
Oh, that feels ticklish.
Oh.
All right. So he doesn't have any rebound tenderness. It's not any extreme pain, and no tenderness. So if he did have any rebound tenderness, or he kind of winces away and grimaces, all of the nonverbal cues of pain, then that would be a positive McBurney's sign, McBurney's test, and he would be positive for appendicitis. All right, so last test, I'm gonna have you go ahead and sit up. And now we're testing for CVA tenderness. This is for any kidney pain. So I'm going to find his 12th rib here. I'm going to go mid-scapular line here. And then I'm just going to place my hand flat and percuss. Let me know if you have any pain or tenderness. Any pain there? And then bilaterally, I'm looking for the 12th rib. And then any pain or tenderness in those areas? Perfect. All right, well, that does conclude our abdominal exam. Thank you so much for your time.